I'd like to introduce you to my friend Margaret Jones, who I've known for some time now, and she's kindly agreed to tell us a little bit about her own story. Margaret, I don't really know your history. Can you tell me when you first became ill?
I was a school nurse and my husband was head of department at Cardew, and we were both in organisations that were going through troubled times. There was nowhere that was happy and without stress, and I just became a victim of it, and I developed bipolar, and I went right the way through into mental illness and the consequences in 24 hours. So it started with my family. They'd taken me to the GP and him being very upset and having a very untidy table and throwing things around trying to get information, referring me to a psychiatrist.
So Margaret, how did you cope with the support and the help that you got at that time? Because things have changed and things do change over the years. Can you give me an idea of how you managed with that diagnosis and how you were supported?
One of the interesting things was that I solved the world by 6:30 in the morning, and I wanted to tell my husband. So I wanted to phone him, but they wouldn't let me phone, and I had no money, and I'd forgotten that I could reverse charge. So I thought if I couldn't phone him, I'll walk home and tell him. So I proceeded to walk home. So I caused quite a stir, and they came and searched and found me and took me back to Ward 5. And therefore, with that action, the psychiatrist thought that I needed medication. And it was orange with white, as though it was milk in it. And I refused to have it. And so that was refusing medication, which isn't allowed. And so I then had to have an injection, but they didn't explain that to me. They didn't explain that the psychiatrist had prescribed this medication to help me. And so in ignorance, I was sat there doing nothing. And they took me from a chair, 4 of them, flung me over the treatment couch, got my skirt up and thrust an injection in my bum. To do that, they had to remove my knickers. Wasn't enough for one of the nurses, and she pulled them even further down. And I was left to recover from that. So that has left a terrible impression on me.
So that was a terrible experience for you. What were the good experiences that you had?
There were 2. I didn't have a good relationship with my mother, and she was 80. And we used to go to the jacuzzi at the Science Centre. And my mother had never seen a jacuzzi before, let alone used one. And we went there, and she went in, and I loaned her my costume, and I was in the nudie because I didn't have one. And she lost 40 years when she was in that jacuzzi, and at 80 she became a mother. So I had a mother for 10 years, which was rather wonderful.
Oh,
and that
yes,
was the
absolutely,
OT.
yeah.
Another occasion which was really good was that I was in the OT department and we were doing calligraphy, and Michael, my husband, came to visit me, and he sat down and started to illustrate how calligraphy developed. And I saw what a wonderful teacher he was, and everybody stopped what they were doing and gathered round him, and it was a wonderful experience for us both. So those are 2 things that happened at that time, which are very memorable, and I thank God for them.
That's a really lovely story, yeah. That's good.
It's important that people, your family, are included.
Yes,
in your treatment.
Absolutely. So Margaret, how important do you think it is that the family are involved with the care?
When they have been included, when they have gone to meetings, we've jumped forward immensely as a result. My eldest son, who is my next of kin, is a technical director and used to telling the World Bank where they've gone wrong, and yet he finds these multidisciplinary team meetings frightening to have. But I find them very reassuring, and they help us as a family to gel together and to move forward.
And there's this booklet being made by a carer and various other carers actually, and it's called the Triangle of Care. Don't know if you've heard of that.
Yes.
And that includes the service user, the carer and the member of staff, so that they're all working together for the same cause, and it surely makes sense that.
Yes, it does. Yes.
It's a good document to read actually.
Yes.
The Triangle of Care.
Yes. And confidentiality is important as well, because the family need to know what having bipolar is all about.
Yeah.
And they need to know about medication.
Yes, absolutely.
They need to know that you're a zombie because of the medication, and you can't help it.
I found it very frustrating when my daughter was ill, because I wasn't allowed to know about how she was, and they would ask her, can you speak to your mum? And she was like a zombie, and she was not well enough to make decisions, and yet I wasn't allowed to know how she was doing. And I found that very frustrating. I think it's important that the family are kept informed as much as possible about the support and care that their loved one is getting. And do you agree with that?
Yes, I think so. Because staff can reassure carers and help them deal with the situation, because the carers have to deal with us when we get home. So they've got all this time to look after us, and how can they do that properly and sensitively if they're not trained in a way in how to handle the situation?
Yeah, I think that carers should be supported more than they are actually, and that they can be a very valuable tool in the recovery of their loved one and take a big load off the NHS, I suppose, because they can actually save money by being the carer instead of them being in hospital. Can you tell me a little bit about the women's group that you're involved with?
Well, this was the idea of Jane Bolton. She's now called Lucy. And she and I were in the day hospital at Gelk Wood, and we used to dream about the future. And she dreamt of having a coffee morning where women would get together over a cup of tea or coffee and just chat, something very simple. And so she talked this idea over with Richard Pratt, who was the priest in charge at St Cuthbert's. And he said, OK Jane, you can have the tithe barn for free and do it. So she said, oh super. So there and then she went to Sue Mason, who was wonderful, and she produced flyers because at that time a certain printers were doing a lot of printing for the Partnership Trust, and they would do these for free. So we got these and sent them all out to libraries and various other places, and it started. And Jane, ever since then, has had a meeting every Monday morning from 10 till 12, either in the tithe barn or at Tully House. And at that time, we got people from the Partnership Trust who came, and they were new to the area and new to the job, and there was an awful lot of hostility around. And we gave them hope and support that they could bring their designs of the trust and all sorts of problems that they were facing, and we would give them support from our opinions. And as a result of that support, they are now top of their field.
Great. I thought that was a really good thing to do, yes.
Yeah.
And just from coffee morning and getting together and having the same goal. Now I know, Margaret, that Michael, your husband, has not been very well over the last few years. Can you tell me a little bit about what has developed from that?
When he was 70, which is 10 years ago, he came to me one day and said he couldn't find his teapot. And I went into the kitchen and found the teapot upside down on the stainless steel sink. And I said, it's there, and he didn't recognise it. So I turned it the right way round and put the lid on, and he said, oh yes, that's the teapot. I thought that was strange, but didn't do anything about it. And then a few days later, he couldn't find his book, and his book was face down and open, and he didn't recognise it. And it was only when I turned it over and closed it together that he recognised that that was the book. So I thought this needs investigation. And the GP sent him to the Carlton Clinic to a psychiatrist who diagnosed the early onset of Alzheimer's. He's been on various medications for many years, but now his behaviour became untenable and I couldn't cope. He said he needed his medication changed from galantamine, which is the Alzheimer's drug, onto memantine, which is a sedative. And that made him into a happy bunny and able to manage. But then he became not able to be left alone because he didn't recognise the house as his own. And when I'd had the conservatory built, I'd moved the furniture out from the sitting room and he couldn't recognise it. And I put signs up everywhere, wooden ones. He didn't use them, he couldn't read them, they weren't the right ones. And I know now toilet, the word isn't the right thing to have on the toilet if you've got Alzheimer's. You need to have a toilet with a lid that's raised, because this is where he is, because he's now in Rose Hill, a care home, in March. And I've had to cope with that, which was very distressing. And the staff don't know how I've coped so long at home.
And you have coped amazingly well, because you've taken Michael with you to lots of the meetings I've been at, and he's been good as gold, really.
Yes.
But you've had to watch and feed him and do everything for him, and that's amazing how you've coped with that. And you still look so great. I think everything started changing again for you in November, Margaret, didn't it?
Yes.
Can you tell me a little bit about what happened?
Well, the thing was, I had a new CPN, that's a community psychiatric nurse. She was called Grace. And she said, Margaret, it's been 6 years since you've had an assessment, you need one. And so she arranged for me to see a locum psychiatrist at Wickham. And he said, at your age, and I was 76, you're older and you don't need the medication that you've been on. I'm going to reduce your Dibixil by a half and your Procyclizine by a third. And this has made a tremendous difference because I'm no longer a zombie.
That's amazing.
And it's just from that psychiatrist.
From reducing your medication?
Yes, it was wonderful. And he said, gave me just one recommendation, and that was be open and honest. And after this assessment, she called a meeting of all of us with the family, which was most important. and we had 13 people in the conservatory, and it was really positive. We had another meeting in January, and that worked well as well. Michael had this episode in the middle of the night when he was very angry and aggressive. Took him to the nurse, so she said he needs to see a doctor. Take him into the company infirmary. And then I went into the hospital, and we were looked after by a lovely mature student nurse, and she looked after us for 3 hours in that A&E. It was wonderful. We really had a welcoming time.
That's a very positive experience, and it's really good. I'm sure the hospital will be really glad to hear that there are some positive stories there as well. I'd just like to ask you how on earth you've coped, and can you give some advice and techniques that have enabled you to cope and look so amazing?
I've had to be my own project manager. My friend said it was impossible for me, the amount of authority that the family were taking from me, and I've had to come back and say, now look here. And being in charge of yourself is very important, and I've had to be careful with my friends. There was one friend I had, or I thought I had, and she said, you've got bipolar, which is an enduring, severe mental illness for your life. And if you have an accident, you will be disqualified from driving, and a whole lot of things in that. She is no longer my friend. There's times when you're my age and you're thinking there's no future, but then something happens and you think, well, if I'd taught myself then something, I would have missed. I would have missed the dementia people who come round once a month, and we have tea in the garden, in the wild garden, and watch the grasses move around in the wind, and we laugh and we comment, and we're sad and we're happy, and you've missed that companionship. No, it's wonderful what you've got. It's wonderful what other people experiences are giving you. And what would happen to them if you did top yourself? You know, they would be absolutely devastated. I've got a beautiful house, and my friends think it's beautiful, just like your house is. Mm-hmm. And I have therapy once a week. I have my nails done. These are 2 coats of purple and 1 of silver glitter. And I have my feet done as well to match. Mm-hmm. And these are my working colours, because yes, I'm part of the patient experience team, and purple is our colour.
Oh right, that's the same colour as the Lisa Bertoletti Fund, purple.
Yeah, and yes, because I've got one of her badges,
that's
you
right,
know, from way back.
Yeah.
And the reflexology I had on Tuesday, there was nothing wrong with me anywhere.
Wow.
Even my bowels are okay at the present moment.
Excellent.
Thank you, Senecott.
Oh wow, that's great.
I was 85 kilograms. I'm now 62. And I've gone from a 22 to a 14. Mm. And it's taken me 5 years to do it, but I've arrived.
The next thing you're going to tell me, you're doing somersaults down the garden.
Oh no, one has decorum.
Well, that's great. Thank you so much, Margaret.
Yeah, thank you for asking.